A few years ago, my mom started to notice sudden chest pain and shortness of breath. Now initially, you might think she was having a heart attack. However, this was not the case. Instead, she had developed a pulmonary embolism, which is when a blood clot travels to the lungs and gets lodged in the blood vessels. And these are very serious and can even lead to death. So today, we're going to use the story of what happened to my mom as a backdrop to help us learn about how blood clots form and why they can be so serious. We'll talk about blood clots forming in arteries versus veins and the different problems that they can cause, and if one is more dangerous than the other. And of course, discuss what puts you at risk for developing clots and what you can do to reduce those risks. It's going to be a hematologic one. So let's do this. So let's start by defining blood clots. The technical term for a blood clot is a thrombus, which is a mass made up of blood components that stick together at a specific location. This could be at a damaged vessel to try to control bleeding, or it could be in an intact vessel, which we'll learn in just a second that this is something we don't want to have happen. But what is a clot made of? Well, the first major players that form the clot or thrombus are platelets, which are small cell fragments that circulate in your blood and typically become activated when they encounter vessel injury or abnormal surfaces. Once activated, platelets become sticky and begin clumping together. Red blood cells then get caught up in this growing mass, and holding everything together is a tough protein called fibrin, which forms a mesh-like scaffold that stabilizes the clot and gives it structure. Now, it's important to note that this process is most often a good thing, but the whole point of this video is to discuss when clot formation can be a bad thing. As far as the good, forming clots is essential for survival. If you cut yourself and start bleeding, your body activates a process called hemostasis, which is the normal, controlled formation of a clot to stop that bleeding. But problems arise when clotting occurs inside an intact blood vessel, without an external injury. That process is called thrombosis, which translates to the abnormal formation of a clot. So it's important to make this distinction. Hemostasis is a good thing. It's protective, it's protecting us from excessive bleeding. While thrombosis is abnormal and can be dangerous because this can create blockages in blood flow. Another key concept we need to understand is the difference between a thrombus and an embolus. A thrombus is a clot that forms and remains in place, whereas an embolus is something, most commonly a clot, that breaks free and travels through the bloodstream. So you could think of an embolus as a traveling clot. And this is a problem because it can eventually become lodged or stuck in a smaller vessel somewhere downstream. And this will cause a blockage in blood flow at a new location. Blood clots can also form in both veins and arteries. And this is also another important distinction because they tend to cause different problems. Arteries, with only one exception, deliver oxygenated blood to tissues. So clots that form in arteries can starve the tissue that is downstream from the clot of oxygen and nutrient-rich blood, and in some cases can result in the death of that tissue. So if we were to get a clot that formed or lodged in, say, like the internal carotid artery that you could see here, or in one of its branches called the middle cerebral artery that you can see here, this could lead to tissue death of the brain, which we call a stroke. Or if you were to have a clot form in, say, the left anterior descending artery of the heart, which is a major branch of the left coronary artery, this could lead to tissue death of some of the heart tissue, which we call a heart attack. But here is something that is crazy about clots that form in veins. There are clots that have been found in veins that can be over 2 feet long. I mean, just imagine if this vein was completely filled with a clot for its entire length and diameter. And so you might be thinking, how in the world does this happen? And wouldn't this cause some major problems? Well, it definitely can cause some major problems, but different from when clots form in arteries. And so this is where we get into DVTs and how sometimes these clots can get so big in veins. Now, I'm assuming that most of you watching this video are interested in your health, and so let me quickly talk about an awesome tool that can give you many incredible health insights, and that is the Hume Health Body Pod. The Hume Health Body Pod is a clinical-grade body analyzer and is much more than just a bathroom scale, as it gives you a lot more information than just your weight. The Body Pod uses bioelectrical impedance analysis to scan and deliver over 45 metrics, things like skeletal muscle mass, body fat percentage, hydration levels, and metabolic age, to name a few. And one of my favorite features is that it breaks that data down into regions so that you can see how much fat and muscle you are carrying in your limbs versus your trunk, and even compare right and left sides, so that you could target any muscular imbalances during your workouts. Now, the BodyPod claims to be 98% accurate, and when I first started using the BodyPod, I was able to put that accuracy to the test because I actually had body composition tests done at a lab around the same time, and the results were nearly the same. So I've been using it for months now, and I've been logging consistent weigh-ins, syncing my sleep and workouts, and even setting milestone goals that I can track in the app. And as a bonus, the BodyPod is HSA and FSA eligible. So if you want to know more about your own anatomy, click the link in the description to check out the BodyPod, and use our coupon code TheAnatomyLab to get 20% off. Plus, that 20% discount also stacks on top of the current online sale for up to 50% off. So go ahead and start optimizing your health routine today. And now, let's get back to DVTs. DVT stands for deep vein thrombosis, and this is a blood clot that forms in the deep veins, most commonly in the veins of the legs or pelvis. Veins, with one exception, are responsible for returning deoxygenated blood back to the heart, which, remember, is different from the arteries that were delivering oxygenated, nutrient-rich blood to the tissues. Plus, there are more veins or more collateral pathways in the venous system as compared to arteries. And so both actually explain how a DVT can form quietly and not cause an immediate emergency, as well as explains how they can get quite large in some cases. Because if you get a clot in a deep vein, you're not immediately starving the tissues of their oxygen and nutrients. And with collateral pathways in veins, you have more detours or alternate pathways to get the venous blood back to the heart. Now, with that being said, it doesn't mean DVTs can't cause symptoms or be dangerous. Many people will experience pain, swelling, warmth, and/or redness in the affected limb, while others may only have subtle symptoms or no symptoms at all. But in a way, you could kind of think that it is better to have those symptoms of pain, swelling, warmth, or redness, because those symptoms can be viewed as warning signs before the more dangerous and potentially life-threatening situation occurs. And this is where my mom's story becomes particularly relevant, because she was one of the ones that didn't have any of those initial symptoms. She only developed different symptoms once a piece of the clot broke off from its original site in a pelvic vein and moved to her lung. DVTs can become dangerous because of the pathway of venous blood flow. Blood from your legs travels upward through the deep veins, merges with pelvic veins, and then flows into the large inferior vena cava, which then enters the right side of the heart. From there, the right ventricle pumps that blood into the pulmonary arteries, which carry blood to the lungs to be oxygenated. If a clot in the leg breaks free and becomes an embolus, it follows this pathway. And the reason why clots breaking free from veins almost always get lodged in the lungs before anywhere else is because as veins move up from the lower leg to the thigh and into the pelvis, they are merging with other veins and getting bigger and bigger until they merge with the largest vein in the human body, the inferior vena cava. And so because the veins are getting bigger and bigger, there are no bottlenecks for the clot to get stuck in. It's just freely traveling through those larger veins until the blood gets to the right side of the heart and is pumped into the pulmonary arteries. The pulmonary arteries will continue to branch and get smaller and smaller as they penetrate into the lungs. And eventually, the clot or embolus gets stuck and suddenly blocks blood flow to that part of the lung. And this is referred to as a pulmonary embolism. And this is exactly what happened with my mom. My mom noticed sudden chest pain and shortness of breath. And her dad, my grandpa, actually died from a pulmonary embolism. So when she started having these symptoms, she was worried about this very condition. And so she and my dad went immediately to the hospital. Pulmonary embolisms are dangerous for several reasons. They reduce blood flow to lung tissue, which disrupts normal oxygenation of the blood. At the same time, they sharply increase pressure in the pulmonary circulation, forcing the right side of the heart to work much harder than it's designed to. This combination is why people with pulmonary embolisms often experience sudden shortness of breath, chest pain, a rapid heart rate, or even lightheadedness. In more severe cases, this acute strain on the heart can lead to right-sided heart failure, cardiovascular collapse, and even death. And this is why pulmonary embolisms are considered a medical emergency. Fortunately, my mom made it to the hospital in time. Initial treatment focuses on stabilizing the patient and then starting anticoagulant medications, commonly referred to as blood thinners. These medications don't dissolve an existing clot, but they help prevent any new clots from forming and allow the body to gradually break down the clot over time. Early on, however, there can still be concern that additional pieces could break off from the original clot in the leg, or in my mom's case, the pelvis. And because of that risk, an IVC filter was placed in my mom. This is a really cool device. It's a small device inserted through a large vein, often through the neck or the groin, and then positioned in the inferior vena cava. Once deployed, it acts like a safety net, catching clots traveling up from the legs and pelvis before they can reach the lungs, while still allowing blood to pass through. Kind of like a strainer you'd use when cooking noodles. And with all these possible treatments, many people recover well, and that was the case with my mom. She was eventually taken off of blood thinners and has had no clots since, and today she's doing just fine. But what causes these blood clots to form in the first place? And are there risk factors that we can pay attention to? Well, prior to my mom's pulmonary embolism, she had undergone a hysterectomy, which is a major pelvic surgery. Surgery, especially pelvic or orthopedic surgery, is a well-established risk factor for blood clots because it involves tissue injury and shifts the body into a more pro-clotting state. And surgeries are often followed by periods of immobility during recovery, which can cause blood flow to be more stagnant and the blood to pool. All of these increase the likelihood that a clot can form in the deep veins. Now, immobility as a risk factor doesn't just have to be after surgery. It could also be during a long flight or a long car ride. Other risk factors include pregnancy, hormone replacement therapy, smoking, and certain clotting disorders. And while it isn't possible to eliminate risk entirely, there are steps that can reduce it. Staying mobile when possible, moving your legs during long periods of sitting, carefully following post-surgical instructions, and seeking medical attention for unexplained pain, swelling, or redness in one of the limbs. And of course, seeking medical attention for sudden chest pain or shortness of breath. So hopefully that gave you some useful information about blood clots. Thank you for supporting our channel, everyone, and we'll see you in the next video.